So in order to reduce feedback from microphones, I'm just gonna go ahead and mute everybody in the call. If you want to ask questions, just type them in the chat box, and then we'll answer each question in the order that we receive it. Any questions that are left unanswered in this call, they will be answered in video form after this, and access will be provided at our leisure, and it'll be about a week from now. So you might wonder, what business do I have hosting a virtual health summit? And truth is, not that much, but I did used to be the head of the athletics department at UBC, and big into health, big into fitness, so excited to be here. So let's just move on, and I'll give a minute to everybody to introduce themselves. Let's start with Kody. Go ahead.
Hey everyone, I'm Dr. Kody from Baseline Health and Wellness. So I'm a chiropractor. I own the practice, and so my background's in nursing. I worked in stroke and medicine in Burnaby, then moved into chiropractic because I got hurt on the job, and a chiropractor helped me out. Ended up doing chiropractic school and a concurrent master's degree in sports and exercise science. And so the populations that I treat are oftentimes physical injuries that are all throughout the body, from neck, low back, all the way into shoulders, hips, knees, ankles, wrists, kind of any joint. And so our philosophy is really to work on the whole person in terms of those physical injuries, muscle, joint, and rehab.
Alrighty, and now you, Christian.
Good morning, everybody. My name is Christian. I'm the certified Pedorthist at Foot Solutions in Vancouver, and my focus is obviously on helping people achieve better health through their feet. We have a location in Kitsilano, just at West Broadway and McDonald, and we really like to work with clients that have anything from hematoes to bunions to potentially plantar fasciitis or heel pain, as well as arthritic conditions that need to be accommodated either through footwear or custom foot orthotics.
Alrighty, Monica. Oh, you're on mute.
Hi, everybody. My name is Monica Nelson, and I'm the founder of Raiz Holistic Nutrition. We are a nutrition. I'm a nutritionist, and so we not only do nutritional consultations, but our main business is meal prep and meal delivery. So we work with clients depending on what their health goals are, and what if they have any concerns that they want to work on nutritionally, we can help them by creating meal plans that are specific to their needs, but also by cooking them from their own home. So right now we're not doing in-home cooking because of the current situation, but we are doing cooking from our commercial kitchen space. And we are delivering meals to everybody. So that's how I mainly support people, because I find that we are very busy in our day-to-day lives. So sticking to a meal plan and a protocol that enhances our lifestyle can be a little bit challenging when things get busy. So that is how I support people. Thank you.
Alrighty, Loren.
Oh, you unmuted me. Hi, everyone. Hi, everyone. My name is Loren Thompson. I'm a registered counsellor at Mindful Space Counselling. I've been in private practice here in Vancouver for coming up 2 years. I focus on, or specializing, especially through COVID, supporting couples in intimate relationships to strengthen and support the bonds of connection and kind of create more gel together and avoid situations that might pull people apart. Also looking at supporting pregnant women through pregnancy. That's a passion of mine, is supporting families. I'm really happy to be here with you all and looking forward to the answering questions. Thank you.
Alrighty, and David next.
Hey everyone, I'm David Turnbull, owner of TurnFit Personal Trainers. We have a team of 7 elite trainers. And I wasn't always super active. Actually, most people don't know, but I was inactive most of my life and actually hated anything self-development wise or workout wise. I was the best gamer, however. So if you game with me on GoldenEye or play Magic the Gathering or World of Warcraft, I will beat you. I got out of that mindset, and now I work so hard on my own self-development that I want to share it with the rest of the world. So if you're looking to level up your health and you also currently don't like the way you're seated so often or inactive, that's okay. I have options for you.
Alrighty, and Heather?
Great. Hello, my name is Dr. Heather Geest, and I'm a naturopathic physician here in Vancouver. I practice out of 2 naturopathic clinics. One is Divine Elements, where we focus a lot on cellular health and detoxification. And then I also work at Kinetic Patterns, which started as a dentistry, biological dentistry clinic. And now it's an integrative clinic with a medical doctor, an acupuncturist, myself as a naturopathic doctor, as well as a biological dentist. My focus in practice is pain management and orthopedic injuries using regenerative injection therapies. So I have a very hands-on approach to my treatments and providing the body with the tools it needs to heal itself. So not only am I working on the injuries, but I'm also supporting people with nutrition, detoxification, IV nutrient therapy, lifestyle modification, and hormone balancing. Thank you.
And last but not least, Andy.
Hey everyone, my name is Andy. I'm the clinic director and a kinesiologist at Kinlab. We are a team of kinesiologists that specializes in motor vehicle accident injury recoveries. We run one-on-one active rehab or exercise programs to help individuals recover from the injuries they sustain. This includes addressing any movement deficiencies, postural dysfunction, muscle imbalances, and weaknesses. Our goal is to assist you on your road to recovery so you can return back to your work or daily or leisure activities. We are a mobile clinic and we operate out of 20 community center locations. A bit about myself: I was born and raised in Vancouver, attended Simon Fraser University to obtain my kinesiology degree, and during that time I was competing in varsity at SFU in the NCAA. I had the pleasure of working for a lot of health professionals in the field before starting my own clinic here. And yeah, I'm a huge basketball fan, so I can talk basketball all day with you guys. Thanks.
Alrighty, thanks everybody. That was great. So let's move on to the question and answer portion of the meeting. If you just came into the meeting, post your questions in chat and we'll answer them in the order that we received them. But I'll start off with the questions we already have. So number 1, how can I sustain my overall health with the long-term impact of the stress that has come from this pandemic? A month or so is okay, but what if this lasts longer? And let's start with David to answer that question.
Yeah, so I am too struggling with that too, most of my life, but it's actually mostly mental, right? So I find anytime that you're moving, you will feel a little bit better, a little bit more energized. When you burn off some excess energy, you'll be able to sleep a little bit better. Typically, when you're out for a walk, you get to soak in like the beauty of things and kind of meditate. Same with your own personal workouts. Every single workout, I strive to connect with my body. So whether it's doing a push-up and I'm feeling every single muscle that's engaging, or contemplating why something might not be engaging, most of it's, again, mental, being grateful for things that you do have. It could be as simple as I'm grateful that I got to wake up this morning. I'm grateful that I have a house. I'm grateful that I did the dishes, whatever it may be. I believe most of it's a little bit mental and a little bit moving.
Alrighty, and Heather, same question.
Yeah, so understandably, this is a very stressful time. And what adds to that stress is just that feeling of unknowing. Just because each day is a little bit different, and like the news is always putting out more information for us. And it's one of those things that, I mean, with stress, it's really important to actually go back within and do things that you love to do. So making sure that even though we're in isolation and quarantine right now, it doesn't mean you cannot go outside. And I highly suggest, as David said as well, getting out, moving around, getting your blood flowing, getting fresh air, because that's really going to help with stress. It's going to just get blood flowing, circulation going. And another important factor is making sure that you're eating healthy and nutritious foods and actually taking care of your body at this time. This is the time that we are at home and cooking more. So I'm sure Monica's going to go into this a lot as well, but making sure that you're actually choosing healthy, nutritious foods. You have more time to cook them right now, and you have more time to sleep as well. So those are things that you need to do, and find things that help you de-stress. And that's going to be different for everyone.
All right, and Loren, same question.
So I've come up with kind of 6 steps that I think would be really helpful. I think this is a really important question, And so thank you for asking this question. So what I like to look at is the first step I've put down is like, it's important to know your predisposition. So going into your history of how you respond in stressful events, learning more about, as a child, maybe how the models in your life modeled being stressed. So that kind of takes into the history and looking at kind of whether you have certain tendencies. So people that struggle with PTSD obviously handle and deal with stress a lot differently. So knowing if you have any sensitivities already to stress will be a huge help. Second is the education component. So really understanding from a physiological standpoint what your body is going through when you're experiencing stress. So that's looking at the fight and flight, the sympathetic nervous system being activated and how that plays out in your body. And then step 3 is really getting a good understanding of your personal response to stress in a moment. So your own personal awareness. So looking at, are you aware of what your body's going through when you're starting to feel stress? And learning to kind of be sensitive and in tune to your own experience in a moment. And then step 4 is really looking at the tools and the techniques that you can implement that will help to alleviate that stress. And basically those tools and techniques are taking you out of your left brain, which is your sympathetic side, and taking you into your right brain, which is your parasympathetic nervous system. So it's doing the activities that activate that side of your brain. So those are breathing, walking, exercise, creativity. So that side of the brain is like music, listening to music is helpful. And like Heather was saying, that everyone does have their own activities or tools that will be more effective. So it's about finding the tools and the techniques that really work for you. Number 5 is after the situation, it's helpful to kind of evaluate and reassess maybe the process that you went through, and if there's anything that came up that you could maybe do differently next time. And then I've put down as step 6, so the last of the steps is knowing when you need to reach out for extra help and support. And I think that's really important to realize when we reach our limits, and we can do so much to help ourselves, and there is a point where we may need extra support. And then with those steps, I go through and repeat. So once you've done kind of your history and you have an understanding of where you're coming to, where you're actually, what you're bringing with you into a situation, and then once you have an understanding of the education, you can repeat then steps 3 to steps 5. So going back and having that awareness, and that's about being present. So having the awareness is about learning how to be present in the moment to what's actually happening.
All right, and we'll give Monica a crack at that question too.
Those were really good steps, Loren. Thank you. So in my practice and in holistic nutrition, we like to see we treat the whole person. And I do know that Heather also works with this model. So when we talk about the whole person, we like to talk about mind, about like three or four components that compose a person, that are not only the physical body, but also the mental, the emotional, the spiritual, and the physical. So all of these 4 aspects will affect, and how we take care of all these 4 aspects will affect our resiliency against stress. So David already talked about the physical, how we can go out and have movement and everything. Loren spoke about the emotional, so how we deal with our responses. So the spiritual is also very important. So that will kind of our spiritual connection, I find, will help us in a sense be able to cope with the uncertainty of the situation, just in order to be able to trust. And in terms of the nutrition aspect and the more of the physical aspect, that also really ties into mental health. Heather and I just did a talk the other day where we talked about the connection between our gut and our mental health, and it's all really connected, because our neurotransmitters start in our gut. So that's why it's so important to take care of the foods that we are putting into our bodies. So reducing the amount of foods that create inflammation in the body is really important. Those foods are processed foods, lots of sugars, lots of refined carbohydrates, all those things. Like, I would always recommend to make healthy swaps. So instead of eating like white pasta, like eating brown pasta, instead of eating having a bunch of like white sugar, like substituting it for more like healthy forms and more natural forms of sugars, such as honey or maple syrup or coconut sugar and stuff like that. So making all those healthy swaps will help reduce the stress that we put in the body and the inflammation that we create in the body. There's also like a lot of, as we are preparing more meals in home, just making sure that we are just adding a lot of vegetables into our food, that will also really help to get all the nutrients that we need at this time.
All right, awesome. So those are great answers. I love the enthusiasm, but in the interest of timing and getting through as many questions as we can, I'm going to try and restrict people to 1 minute answers, maybe with a little bit of leeway in order to get through as many questions as possible. So moving on to the next one, we got, is sitting down for 8+ hours a day the root cause of all of our problems? And let's get Christian to answer first.
Is sitting down for 8 hours a day the root cause of our problems? I mean, you could probably say so. I mean, that's kind of sitting is the new smoking is what some of the studies have shown out there nowadays. But being in the health and wellness sector, I myself noticed that if I'm doing office work at home, I'm not feeling as happy at the end of the day as I do when I'm working in retail, where I do have the ability to get up and down all the time and work with clients on a one-to-one basis. But there's a lot more movement in my day. I think some of the other health professionals on the call might have some better answers to that. So let's maybe ask David next.
Sure. Yeah, let's get David to go.
Yeah, I strongly believe that, like Christian said, sitting is kind of our new smoking. I for sure noticed it. Like, again, I used to be a network analyst, computer nerd, sit on my butt for 10 to 12 hours a day. In my early 20s, I had so much pain in my body, so much frustration, so much anger. Right now, during this call, just sitting, anybody that actually knows me knows I don't sit. I'm always out walking, doing all my meetings. I like to hit at least like 20, 30,000 steps a day. That's pretty extreme. I'm not saying the average person should do that. The average person, I would aim for maybe 5 to 10,000 steps, but I usually see office workers, the maximum steps when tracked are like 3,000 a day. That's from their home, probably to their car, to their desk, and walking around from the break room and then back home and sitting. So I would say at least try to take an opportunity to at least go and enjoy a walk, at least for half an hour a day. Just start with that, or even 10 minutes. 10 minutes is better than no minutes.
All right, and Andy?
Yeah, I guess just piggybacking off what everyone says, seeing the root cause of all problems, I guess it really depends, in my opinion. I know a lot of people associate that with a lot of, I guess, premature mortality risk, and there are a lot of studies that kind of link the two, but I think more importantly, it is more often associated with sedentary behavior, and I think that has a more, I guess, profound outcome on a person's health. Obviously, just looking holistically, there are a lot of factors associated with, I guess, our problems, for lack of a better word, genetics, environment, nutrition, stress. And I think people who sit often are often very sedentary, and that in itself is very associated with premature mortality risk. Some general guidelines from health organizations: 150 minutes a week of moderate to vigorous intensity exercise, about 57% max heart rate, I think, would go a long way. And just what kind of like what David said, just taking frequent breaks. You don't want to be sitting 8 hours straight for your day and then sitting on the TV after for another 4 or 5 hours. So yeah, take a break, do some exercise, and yeah, don't be too sedentary, and you should be fine.
All right, and Kody?
Yeah, so I actually did a blog on this, which is coming out on Friday. So a study from the American Journal of Public Health actually compared those who sit more than 8 hours compared to those who sit less than 4 hours, and the results are kind of alarming. Not to scare people, but more so just to say, like, get up and move around. But there's nearly 2 times higher chance of type 2 diabetes in those that sit 8 hours or more. A 10 to 20% increase in cardiovascular disease, 13 to 20% risk of dying from cancers less than 4 hours of sitting, and increase 20% risk of depression for those who sit. So that's just from a study that they just brought up in 2018. And so what that tells us is just that our body gets used to positions and basically stresses on the body from gravity as well as just stagnation. So in terms of that, if we can change some of those by just getting up, getting a glass of water, doing some movement, going for walks, doing some of this, I think it can dramatically change our lives for the long term. In terms of, is it the root cause of all problems? I don't think so. There's a lot of different challenges for a lot of people, but it is a contributing factor to the society that we have today, where sitting has replaced a lot of physical labor.
All right, and we'll give Heather a crack at that one too.
So yes, I have agreed with everything that everyone has said so far. But in regard to sitting for more hours of the day and just us not being as active, it is one of those, like, it's another straw that could easily lead to more health conditions down the road. So when I'm seeing a lot of pain and injury in my clinic, it's mostly pain has a lot to do with inflammation in the body. And if we're sitting and sedentary for that long in a day, we're not actually getting that blood circulation and joints and ligaments and muscles moving to allow fresh blood and fresh oxygen and nutrients to those tissues and allow the body to actually get rid of the like toxins and waste products, kind of like a cycle. It's got to bring in good nutrients and actually get rid of the other nutrients or toxins. So I think it's a contributing factor to a lot of health conditions down the road. And like Kody said, our body gets used to the positions that we're in. So if we're not moving through full range of motion, like with our shoulder or even our legs and our hips, and moving them in all different directions, as soon as we end up going into a different position that we're not usually used to, that's when injury occurs. And that's where we tweak our back or we tweak our knee, because it's not used to those motions from sitting so long.
Alrighty, well, I sure don't want to sit after hearing all the answers to those questions, trying to stand up here, but let's move on to the next question. I have a grade 2 partial thickness tear along the articular surface of the distal supraspinatus tendon and more. I'm in a lot of pain. What should I do for treatment at home? Let's start with Kody.
So in terms of that, it's a rotator cuff injury in terms of it. So a lot of it is inflammation based. So I think Heather will have a lot more answers in terms of the acuteness of that kind of condition. My side is looking at, typically with those, is for all injuries, the first step I usually say is get pain-free range of motion back. So with some of these cases, especially when there's a tear in it, you don't want to be loading it to create more injury in terms of that. So oftentimes it's simple exercises as wall crawls. So putting your hand on the wall and just reaching up, pain-free range of motion, and trying to challenge that to get a little bit further, getting a little bit more motion as we're going through that. Oftentimes I work on taking down muscle tension that guards that injury. So oftentimes the trap, the pec, some of the other rotator cuff muscles get really tight and create some of that. So if there's any irritating factors, usually it's overhead lifting, grabbing stuff from overhead, from behind you, and just using that. So shoulders are a complex joint. So sometimes it just requires a consultation. If it requires, reach out to me, Heather, any of the other practitioners who may be able to help in this case. And I'm sure any of us will give some guidelines to see, because every condition is slightly different in how they present. So I don't want to just give you a blanket statement that it works for everyone, just more so if you need some help, just reach out for us.
All right, and Heather?
All right, I saw this question and I was like, this is my jam, I love it. So I'm sorry that you have that rotator cuff tear, and for exercises at home, I mean, without seeing it, I really suggest, as Kody said, like stretching it, doing motion, adding some motion. I mean, the saying goes, use it or lose it. A lot of people, when they have an injury, they start to favor it, and that's going to decrease that range of motion even more and not allow, as I said, those nutrients and blood flow into the area to help heal it. Another thing is adding heat to the area. Heat is going to bring more blood flow, more circulation, and especially into a rotator cuff, there isn't always as much circulation when we're getting like close to the joint. So that's important. And then also just stretching out the muscles around it with a tennis ball, just to prevent any tension or tightness, because that tightness will pull on the injured area again. But, you know, if it does continue to bother you, I do suggest seeking treatment, or at least suggestions for treatment by Kody or myself, because there's a lot we can actually do in office to help support you and then continue your treatment at home.
All right, and Andy?
Yeah, just I think Kody and Heather can relate. It's a pretty general question, and we would love to kind of get a further assessment to diagnose. I'll give a bit of context. Supraspinatus is kind of originates from the top third of the scapula and attaches to the humerus. It does mostly abduction of the shoulder. A lot of things we see, depending, like obviously during the assessment, if we were to see you in person, just getting a history, how did you injure it? Is it more degeneration? Is it like you were throwing a baseball, more acute? How do you even know it's a grade 2 strain? Did you get an MRI? What kind of treatments have you done? When did you get injured? What's your age? So just more comprehensive information about everything that's going on. If it's a more of acute, for example, if it happened in the past 48 hours, a lot of the rehab stuff you would do at home is more management. So kind of like what Heather said, improving circulation, controlling inflammation. Following that with home exercise programs, I would focus a lot, obviously range of motion, starting off with passive range of motion. So you can use a stick from one hand to assist with the other hand, just to kind of see where your painful arc is for that supraspinatus tear. I would probably assume that in the first 9 degrees of abduction is when you'll have the most difficulty. So trying to obtain that range back passively. After that, moving on to more active movements, working on shoulder or scapula stability and control. And then when you start loading, and be very cautious when you do this because you don't want to cause more inflammation and damage. An easy way to do it is maybe to even do it eccentrically. So you bring yourself passive up to 90, and then you control it slowly down with the assist of your other hand using a stick or a towel. But yeah, like with the information we have, we would love more information through an assessment, and then we can have a proper, I guess, treatment plan going forward. Another thing I would say is just to have a look at your T-spine or thoracic area, just checking out the mobility and the function of that, just to see if you're not compensating through your shoulder for that. I'll be happy to help you out. Whoever asked the questions, just feel free to email me, and I'd love to follow up. So I think you can, info@kinlab.ca, and yeah, well, I guess we can get into a bit more details, but that's kind of the general guidelines there.
All right, and next question, can you walk yourself to better health? Let's start with Heather.
All right, can you walk yourself to better health? I would say that's part of it, but I wouldn't say that only doing that and not adding any other factors in won't be your best strategy for it. So, I mean, you can walk yourself miles and miles and miles actually, but if you're not actually feeding the body good, nutritious food, you're not kind of supporting the body in all the other ways. And this kind of works for all types of questions. I mean, decreasing inflammation, making sure that you're working and exercising, or working out and exercising. Those are all important. Walking is great, and it's a good way to like burn off a couple extra calories. I would also add some weight training in there to actually like load the joints, because when we add a little bit of stress to a joint and to a muscle, it actually builds stronger. So doing it in a safe way. If there's an injury that only allows you to walk, then absolutely. Any movement's better than none. And I'll pass it on to the other guys that will also have some other answers.
Yeah, let's go with Kody.
Yeah, I think I agree everything with what Heather said in terms of, I think it's a good activity to get people started, as well as it's a good activity to keep people mobile. And get everything moving. The challenge, I think, with just doing walking as your exercise is, from my standpoint, from a physical standpoint, walking is very what we call one dimension. You're only moving forward and back in this plane of motion. And so as a result, you don't train your body in terms of the other motions. And so therefore, there is risk of getting injured. Similar to running, oftentimes some of the muscles that are utilized, they're always the same muscles. So in terms of it, our body thrives on changes and different stressors and challenges in order for it to grow. And so oftentimes, like exercise rehab base, we're training in different planes of motion. So side to side, on angles, on rotation, because our body has to do a lot of things rather than just going forward and back. You have to twist to grab something, you have to reach up, you have to do these things. These are components that I agree with Heather, that if you need some type of weight training, some body training to create some of those awarenesses so that you don't get injured. And I think that can also contribute to better health as well.
All right, let's give David a crack at it.
All right, so since everybody knows I love walking, I would say it's an excellent recovery tool, and it will help get into the mindset of doing healthier things. So let's, for example, Monday to Saturday, I usually walk all the time. Sundays are my day off. Well, guess which day I probably eat bad? Sundays. So usually when you're not active, that's when you have more unhealthy habits, I would argue, for most people. If you look at just for fat loss, let's say, never mind on a cellular level, but if you look at like my personal fat loss on winter versus summer, winter I barely walk, summer I do all my walking, and I can easily shred like 10 pounds of fat by my walking. Keep in mind, I am an extreme personality, so I do a lot of walking, but you can't out-walk a bad diet, like everybody else was mentioning. For example, if you do an hour walk, maybe it burns 250 calories, and now you go into the store and get a chocolate bar, and that's 250 calories. It won't balance. It's way easier to overeat if you're just talking just like on fat level and health that wise. On a cellular level, it is really good walking to help repair. Again, as mentioned before, if you don't use it, you will lose it. And I witnessed, for example, I have a 90-year-old client here in Vancouver, still plays hockey, still plays golf, still super active. And the one thing he's done all his life is, on top of his exercise, is walk daily a couple of hours every day. I look at the 90-year-olds that are in Winnipeg, and actually most of them don't even exist at 90, but the 70-year-olds are in worse shape in Winnipeg, where you typically don't walk in the summertime because it's too hot, or in the wintertime because it's too cold. And they usually decline a lot sooner. It's not all to walking, but usually when you're doing healthier things like walking, you'll have healthier probably diets.
All right, and Christian?
Right, for us, obviously looking at it from a walking perspective is, you know, with shoes, if your feet are hurting, it may be difficult for you to go out and walk, right? So, I mean, I think there's, like walking is a great activity, but if there is issues that are keeping you from doing that, you might want to look at other options, you know, maybe swimming, maybe, you know, cycling, maybe stationary bicycle, something that is going to not put as much strain on the feet, right? So, I mean, from our perspective, if there's foot pain, we usually kind of, recommend doing some other exercises first before going back into walking. Or the other thing that I did train on in the past is Nordic walking, which is walking with the poles. So it actually increases the range of motion through the shoulders. And it's a great activity. It was developed back in Finland by cross-country skiers who wanted to keep their fitness in the summertime, but didn't necessarily want to find long stretches of pavement to be able to use their roller skis. But those are some of the things you can add into the activities as well to get better upper body strength, but also increase range of motion through the upper body, as well as taking some of the stress off your knees, off your by putting that weight onto the Nordic walking poles themselves. So if you have any questions around that, please feel free to reach out to me and I can help you out with that too.
All right, here's an interesting one. Posture corrections and core exercises. Perhaps some core exercises practiced while sitting during this time, sitting at the computer, watching Netflix, Zooming, etc. Let's start with Kody.
All right, so this is a really loaded question. So a minute is not going to do it justice. So I'll talk a little bit more about the postural correction. I find that a lot of people in their postures, as soon as we say posture, they sit up straight. So when you sit up straight, what happens is oftentimes we've been kind of programmed to sit up tall, but not really know how to. Oftentimes the compensation comes from the low back, where when you sit up straight, you probably can't see it, but this looks good to someone else. So your mom who told you to sit up straight when you were a teenager tells you this. But if you were to stand up, I don't know if you can see this, and I don't know if I can actually show, but if you stand up, you're technically actually in an extended position while you were sitting. That's actually putting a lot of load on your spine. And so that's actually not an optimal posture anyways. Oftentimes when we say sit up straight or good posture, it actually should come from the middle of the spine, where your chest is coming up, but your low back stays the same. So I think more so postural issues come from shoulders rolling forward rather than actually the low back being in a terrible position. And so I think like a lot of times the rule of thumb is keeping your ribs stacked on top of your hips. That is when you know you're actually neutral. And then if things still don't look good, it's probably from your upper back that you've just kind of hunched over in terms of that. And those are different exercises where Andy said before, thoracic mobility is a huge component of that, as well as muscle tightness. In the blog that I was talking about earlier that's coming out on Friday, it has a bunch of exercises at the bottom. There's too many exercises to show. I would just direct you over there. There's a lot of videos that you can just look at and you can start fixing for yourself.
All right, let's give Andy a crack at that one.
Yeah, next question. No, can you repeat that for me? Just because there's a lot of different things in there.
So we're looking for posture corrections and core exercises, namely some core exercises that we could practice while sitting during this time, like sitting at the computer watching Netflix.
Yeah. So like with sitting, I guess I would just give like Kody said, it's a loaded question. I'll give a bit of insight in maybe one aspect of it. With sitting, a lot of people have an anterior pelvic tilt. Like how Kody said, like just stack the ribs over the hips. So a lot of core engagement exercise with sitting, I guess you are a bit limited in what you can do. Like Kody said, instead of just popping everything back, just making sure like the areas in your shoulders are good and you're not so forward hunching. Exercise while sitting, you can do a lot of contractions, a bit of band work, even kind of anti-rotation work if you have a band attached to a door. In general core work, there is obviously a lot of things you can do. We see, especially relating back to the questions of sitting 8 hours a day, we do see a lot of hip dysfunction and misalignment or orientation functions through the pelvis, and that needs to be addressed not only through the core, but it could be, for example, through hip flexors or glutes and stuff like that. So just, I guess, a more holistic approach on a bunch of different aspects contributing to your posture, especially from the hip or the core down.
David, let's see what you got.
Yeah, so doing it while seated could be a little bit challenging, but I agree with Andy and Kody that what I like to do if I'm seated is I just find where my lower ribs are, find where my hips are, and try to have them kind of stacked over each other. And then what I usually like to do is work on diaphragmatic breathing. So I inhale into the sides, into my belly, into my back. And usually when I do that, I actually can find that my spine actually feels like it's lengthening, and I can hear it kind of popping. But when I first try to activate core strength, I would suggest, like, sitting is kind of hard to do at first. I like to do it laying flat on the ground. And then you can have a better way of seeing if your ribs are stacked on top of your hips, seeing if there's a huge arch under your back. Because yeah, most of the time, like Kody mentioned, the old habits of what we're used to taught is sit up tall. And then when we do sit up tall, we fling our shoulders back, and then there's a massive arch in there. When there's a massive arch in your back, good luck trying to activate your core. So, and keep in mind also, listeners, core is not necessarily abs. It's not doing crunches. So.
All right. So here's an interesting one. How do I know I'm buying the right shoes for my everyday walking? And we've got to direct that to Christian.
How do you know you have the right shoes for your everyday walking? Well, I mean, there's kind of three foot types that we see. Number one would be a supinator, which is somebody that kind of walks more on the outside of their feet. Then we have pronators who walk on the inside of their feet, meaning they spent more time walking on the inside of the foot than they do on the outside of the foot, and that's the exact opposite with a supinator. Whereas with the average person that has kind of an average foot, you know, there's not going to be a whole lot of anything. But really, when it comes down to using the right footwear, is number one, it has to fit right. It has to be long enough, it has to be wide enough, and it shouldn't be, you know, kind of sloppy around the ankle, you know, because a lot of times what we find is that, you know, the idea of a shoe is to kind of protect the foot from impact on hard surfaces and give it some padding, but at the same time it should give you lots of room for your toes to wiggle in the front, and you shouldn't have the end of the shoe rub or push against your toes, which could potentially cause you to kind of retract the toes and then create hammer toes and other issues, or potentially even tightness in the rest of the body because of the fact that you're constantly clenching your toes. So one thing is really to make sure that you have enough room at the front, and that's usually about a finger width of space between the longest toe, and longest toe being the really important aspect here, because longest toe may be the second toe and may not be the big toe. And then between the longest toe and the end of the shoe, there should be about a finger width of space. And you can usually check that by taking out the insole of the shoe and standing on it. And then also width-wise, you can check whether or not the shoe is wide enough by standing on that insole and seeing whether or not your toes are overlapping over the sides, because that means that your footwear is going to squish your toes together, which could potentially lead to Morton's neuroma or other forefoot issues that we don't want to see. But those are kind of the three main things. So have enough length, have enough width, and make sure you have good support around the ankle so your foot is not kind of wobbling all over the place as you're walking in the shoe, and it feels secure on the foot.
All right, so another home treatment question here. What about SI joint pain? It may be related to a torn hip labrum. What should we be doing for treatment at home? Let's start with Andy.
Yeah, I think about SI joint pain, I think this is probably the person asked this when we were answering the shoulder question. So there's a couple things we can do. I think with the torn hip labrum, just address a few things to address that. Just maybe even banded assisted mobility work where you're increasing the joint space capsule in there so you can get a bit more range of motion. I'm assuming with that you get very restricted motion, especially with some flexion, for example, and most likely causing pain. In terms of the SI joint pain, there's so many factors that can relate to that or cause that. And so obviously, as I mentioned in the previous exercise, just having a whole history and an assessment to identify what is going on. For example, just on checking hip alignment, checking mobility, checking strength, checking posture, and just having a more holistic idea of what's causing that pain before providing a treatment plan. But in general, there's a couple things to work on. Kind of mobility through the hips if there's any issues, strengthening glutes, back, core is, I guess, a general guideline, but I would love to get more specific once we kind of dive in there and kind of find more information on what exactly is causing pain. So, yeah.
All right, and Heather, do you want to touch on that?
Yeah, so it really depends what's happening with that SI joint. So the SI joint is one thing, but there can also be issues just even in regard to like the femoral head or posture, or even a leg length discrepancy. So it really depends on where that SI joint pain is coming from, if something's stuck or if something's too mobile and too loose on the other side. So this would be a excellent thing to actually see in clinic so that we can get the history of it. We can actually physically put our hands on the area that's sore to see where the injury or the pain is coming from, and then suggest treatments that are specific to the problem that you have. Because yeah, sometimes people will come in saying that they have one diagnosis, but that's why I always do my own assessment as well, because sometimes either something will heal up or it could be presenting in a different way. And so we need to actually tailor the treatment that's right for you. So I would do an adjustment or some like soft tissue work, some acupuncture in this case, the structural assessment, and then injections if there was like a ligament, a loose ligament or muscle strain.
All right, and Kody?
Yeah, so I completely agree with what Andy and Heather said. Every condition is slightly different depending on the person. And so everyone's individual and they react to injury differently. So in terms of that, you may have like a torn hip labrum, which inherently is unstable because the structure is damaged. However, we have to look at it functionally, and does that hip actually have any challenges, or have you actually created a lot of functional imbalances to protect it? And that is why your SI joint pain is happening, because it's been compensating and the wrong muscles have been creating some of this. So it's hard to say. Like a lot of times, I've seen some torn hip labrums that actually don't present. Like there's actually no problems with it because their muscles have been able to guard. But then they may have knee pain, they may have hip pain, they may have SI pain due to glutes being tightened, due to the quads being tight, due to the core being inactive. There's a lot of components and there's a lot of environmental things that if you're sitting at work, if you're not sitting, if you're doing all these things, that can be all contributing factors. And so, like I said, like Heather said too, there's a lot of components that we can work on and help with. We just need a bit more information in terms of the case. And sometimes they do require surgery. And I worked with Heather on some of these cases where sometimes just injections themselves can help. And sometimes if on lighter cases, working with Andy and myself, working through exercises and muscle work can make it tolerable. We don't know. So yeah, there's a lot of exercises that can be given. We just need more information.
Right, and here's a cool question. Do we need to put more emphasis on the psychological level to motivate / change the mindset of these people? And also at the macro level to change societal norms in the environments that we live in? Let's start with Loren.
I got it. So yeah, great question. I like to think because everything that we do is all connected, I think it's really important that we have kind of a balanced view and like a whole, like we've been all talking about today, is kind of a holistic view on yourself as a whole being. So if your mental health has been neglected or it's not been maybe a priority or something that you've ever invested time or energy into, then that would be something that I would encourage you to look at. So putting more emphasis on is really, I would, from my point of view, would be based on how much effort and energy you're putting into it right now, compared to everything else that you're doing. And keeping all, like if we think about the physical activity that we do, if we think about our emotional health, our thought, like I like to think of the mental, like our psychological level is also like having a grasp of kind of our thinking and how we think and our thoughts and our beliefs that we take with us and how they play out and how they shape the way that we think. So getting an understanding of that, and then also having an understanding of our emotional body and what part our emotions play. And then understanding also kind of the spiritual aspect that Monica brought out, is understanding what spirituality means to us, because it means something to everyone. And everyone has their own, some people their spiritual spirituality is just being in nature. So everyone has a different aspect, but I think it's looking at all those components. Also your physical body and your physical sensations and what state your body is in. So I think not so much emphasis, but bringing in a balance. If it's unbalanced, then yes, it will need more emphasis. And then looking at kind of the macro level, I really am a big advocate that when we change our world. So I like to think of when we do the changing, when we fill up our pots and make sure that we are balanced and that we're living holistically, then we will have a ripple effect. Like that droplet of water as it comes in, it will be like the closest people to us start to, but every interaction that we have, I like to think of it like the tree roots. We're all connected. So whenever we bump into someone or whatever activity or interaction we do with someone, we can be passing off our own nutrients to them if we have our pots full and we're able to do that. So we can heal and change our world by doing our own healing and our own changing.
All right, let's hear what David has to say about that.
All right. Yeah, so for the mental aspect of it, I just think of, for everybody that asks similar types of questions, I just think of, what do you want to be like? I know for myself, yeah, I want to be like over 100, 120, but I want a quality of life. So what things do I have to do for myself now to kind of get there? And then mentally, everything is a little bit easier. It's a lot easier to do nothing and mentally just be like, okay, yeah, I'm just getting around through the day. Yeah, that's nice. But yeah, like you mentioned, the mental focus has to be there. So you just kind of have to think of, what is the best version of yourself look like? What would you like to actually do? For myself personally, I want to see if I can be 120, but have quality of life. Like my 90-year-old client that travels around the world, plays hockey, plays golf, still drives, has an amazing life, acts like a 20-year-old. Like that's what I think. So I've seen that it is possible to live life healthier, happier, and still age gracefully. So that's the mental part that I say to all my clients, and what I do every day, because it's easier to actually kind of just be like, do nothing and then be grumpy, depressed David. But what do I actually want the best version of David to look like? So that's kind of what I do mentally.
All right, and Monica?
Thank you. Yeah, this is an absolutely great question, and I've been talking about this a lot on my Instagram stories lately. I find that to some level, to change the mindset and to change the societal norms, we have to like evaluate the societal norms that society basically has and our own programming has placed on us, and evaluate whether like these actually resonate with our truth. And if they don't, we can find ways in which to basically reject these societal norms and basically like live more in truth with our own values. And in order to kind of like change the mindset and continue motivating ourselves, I find that we need to talk about see that our ego, there's kind of like a mental chatter that that wants to keep us in the same place that we are, and keeps us from being motivated to do things. So like checking in with that ego and that little voice that tells you that you can't do it, and connecting back to the truth and establishing that you actually can do it, right? And I do believe that I completely agree with what Loren said, that when we start making those small changes within ourselves, we begin to create that change that we want to see in our communities, and it starts creating a ripple effect, because it's not only begins to be a change within our families, our community networks, but it begins a ripple effect into a greater shift in our global community as well. So all of this is really important work that we need to do collectively. And it's a great time to start doing this work right now, since we are at home at this time.
All right, and Heather?
Great. I've loved what Loren and Monica had to say there, and David as well. Yeah, it's really about making the small changes just in your everyday life, whether it be from the foods that you're eating to the people that you're surrounding yourself with. Because I mean, we take on that energy of the people that we're around, and when it comes to food, I mean, even where that food is coming from, all of it has like an energetic perspective, and this all affects either the hormones in our own body by what we eat, and changes our mindset. And I mean, I saw this question about mindset, and it really comes down to digestive health. And that's why no matter what people are coming in to see me for in my clinic, everything comes back to digestion, because if we're not absorbing our foods, our body isn't getting the resources it needs to actually make those changes. And they affect the neurotransmitters in our brain. Monica and I did a talk on this last week. And so, yeah, kind of the mindset piece. I mean, also just having like positive reinforcement for yourself, whether it's looking yourself in the mirror and giving yourself that compliment. Also just being receptive of compliments that people give to you as well. I see a lot of people, they'll give a compliment to somebody, and that person will almost downplay it and be like, oh, yeah, it's not that good, rather than actually just accepting that compliment. So mindset, positive thinking, making sure you're meditating, adding yoga if that's something that you practice, but just really surrounding yourself with positive people and doing positive things for yourself. And then on a macro level, just that I guess is also the societal norms and who you surround yourself with. Thanks.
All right, let's hear from Kody.
So I think I love the answers from everyone, but instead of kind of beating on that same topic, because there was a lot of great answers, I'll talk to it from my past background as a nurse. So from a primary health kind of model, what we're looking at in order to facilitate change with a lot of people is education. So I think a lot of the components are coming through, and there's a lot of initiatives. I was in talks with someone who was designing a program out in Europe. And so they're talking about using AI technology to help facilitate changes for people's health in the long term, in terms of psychological level and being able to connect. So a lot of changes are happening in terms of using devices that we have, smartwatches, stuff like that, to identify some of the environments, some of the societal norms that we have. For example, even sitting, postural needs, sleep, all these things are tracked, but no professional has access to it. So a lot of companies and a lot of different people are actually looking out there to create some of these products to facilitate the healthcare providers like ourselves to better help our clients. And I think a lot of it comes from education. And so something like this summit that we're doing is to help the public learn about how to basically address some of these challenges and take a step into that change. No one can help make that change. I think an empowerment from our.
I think we might have lost you, Kody. I'm gonna move on to the next person while hopefully your internet resolves itself. Sorry if I cut you short here. Let's go with Christian.
Well, I think everybody touched on some really good points here, and I believe, like, really what it comes down to, motivation comes from a kind of a dream, something that a purpose, something that you want to accomplish in your life. And that really, has to be kind of the first item that you have to put on your list to figure out, okay, well, what do you want to do? I mean, David kind of touched on that, living to 120. but figure out what that overall goal is that you want to accomplish and that you want to achieve, and have more than one goal, right? Because if you once you achieve a goal, the motivation might stop, because you have to continuously add to that list of things that you want to accomplish in your life, in order for you to be able to be motivated daily to do the things that you need to do in order for you to get there. And then just coming down to figuring out, okay, what are those daily habits, those daily routines that